Stephanie Douglas shouldn't be alive. Just ask her.
My heart was not pumping. It was not pumping blood and oxygen through my body to my brain. So I was going to die.
She collapsed inside a fast food restaurant last year when her heart suddenly stopped.
And I remember thinking I was really dizzy. Not even sure that I completed that thought, but the next thing I remember was waking up on an ambulance.
Stephanie was saved first by a nurse who just happened to be in the drive-thru and ran in to start CPR, then by an automatic external defibrillator, or AED.
The only thing that was going to reverse my heart rhythm and start my heart again was that electric shock.
Within the first few minutes of someone suffering a sudden cardiac arrest, studies show that about 7 to 10% decrease in survival rate for every minute that passes. And having an AED will allow you to increase the likelihood of survival in that patient.
Dr. Celeste Reese-Willis says there are clear guidelines for where businesses, landlords, or public buildings should put AEDs.
The type of buildings that would be great to have AEDs would be shopping malls, convention centers, airplanes, airports, any place where there are going to be a lot of people in a public place. The best place to place them is near the elevator or near a cafeteria, in places where you're going to have people that are at risk for having a sudden cardiac arrest.
So we set out to see if you collapsed in some of Birmingham's busiest public areas, would you have the help close enough and in plain view of a witness to save your life? We started at the downtown branch of the Birmingham Public Library and couldn't find an AED. The clerk at the circulation desk we asked didn't know if they had one and where it was. We did find one at the Jefferson County Courthouse on the first floor near the Revenue Department, but across Lynn Park inside Birmingham City Hall, we were told the AED was stationed on the third floor, but we couldn't find one outside the City Council chambers or in the lobbies of the second or fourth floor. We did find one right outside the Birmingham School Board's meeting room. We did not see one clearly marked in the exterior walls of the Summit as we drove by, and we didn't find one clearly marked inside the Belk store. Clerks there didn't know if the store had one. We also checked and found two inside the Galleria, one on each floor, but not marked on the map.
They're not in enough places, and if public places, if businesses have those available and have people that are trained to use them, which is pretty much anybody who knows CPR, but if their staff knows where to find them, you're going to save a life. It doesn't do any good if it's locked up in an office somewhere. It has to be, it has to be out where people can find it, where a staff person can get to it. Just any bystander that says, hey, I'll go grab the AED, they have to be able to get to it, otherwise it's useless.